Hi, my name is Lingling Shang. My presentation is about substance abuse with depression and the safety of antidepressants. We know substance use and abuse is very common in America. The rate of death due to substance abuse is pretty high. The first reason I want to study the correlation between substance abuse and depression is that I noticed substance abusers experience depression symptoms of withdrawal, and more young children were trying substance. First, let's see how substance affects on human body. Take ketamine user for an example. From the article of ketamine use, cognition and psychological well-being. In this study, the researchers aim to determine how variations in ketamine use and abstention from prior use affect neurocognitive function and psychological well-being. They assessed a total of 150 individuals' performance in cognitive tasks. It shows that frequent ketamine use was associated with reduced psychological well-being and broader range cognitive impairments. Infrequent ketamine use was associated with increased symptoms of thought disorder, delusions, and dissociation, but no cognitive impairment. Ex-ketamine users demonstrate elevated levels of delusion, but again no apparent cognitive impairment. The researchers concluded that frequent ketamine users were impaired on spatial working memory, pattern recognition memory, and there were no differences in the performance of the infrequent ketamine users or ex-users compared to the other groups. We have no ketamine use and other substance is harmful, but still many adolescents get to try. Once they got addicted to it at a young age, they would be more vulnerable to psychological dependence and more likely to get behavioral disorder and internalizing disorders. From the article of Development course of illicit substance use from age 12 to 22, links with depressive anxiety and behavior disorders at age 18. They collected data from 585 participants in the Child Development Project and examined comorbidity among substance use, behavior, and internalizing disorders at age 18. At first, they assumed that behavior disorder and substance use disorders will show a great deal of comorbidity on the basis of previous research. However, they found that the nature of the association between internalizing disorders and substance use disorders is less clear. Overall, they found that substance use disorders were more highly comorbid with behavior disorder than with internalizing disorders. And behavior disorder and comorbid behavior internalizing disorders were related to trajectories characterized by steep increases in illicit substance use during adolescence and high rates of illicit substance use over time. They wrote that in their research sample, meeting diagnostic criteria for comorbid internalizing disorders a behavioral disorder alone, or both internalizing and behavioral disorders, predicted higher current substance use disorders. When I deeply investigated depression and substance abuse, I found depression symptom is highly coexisting with some kind of substance use. From the article of depressive symptoms in adolescents, association with white matter volume and marijuana use. Marijuana user had significantly high scores on a depression rating scales along a continuum of intensity from mild to severe. When they go to a certain level of intensity and frequency, they become consistent with a diagnosis of mood disorders like a major depressive disorder, bipolar disorder, and substance-induced disorder. This article is to examine the relationship between white matter and hippocampal volume and depressive symptoms, as well as whether marijuana use moderates the relationship between brain structure and depressive symptoms in a sample of 32 adolescents. However, they did not find white matter volume differences between the groups. Although the differences in white matter microstructure may exist, so they suggested that marijuana use is unlikely directly or solely responsible for the subtle white matter abnormality associated with depressive symptoms in this sample. In summary, their study found significant negative relationships between white matter volume and depressive symptoms in adolescents, especially among marijuana users, and a longitudinal study will still need to examine the developmental causes of brain structure in conjunction with depressive symptoms among substance-using and non-using adolescents. It won't be too late to seek for medical treatment for substance-induced mood disorder or major depressive disorder. But we should know medical treatment has risk and side effects. From the article of Review of Efficiency and Safety of Antidepressants in Youth Depression, the author said that the aim of this paper is to review the efficiency and safety of antidepressants in youth with depression based on recent large RCT. Examine published, presented, and unpublished data. They also review clinical trial data, including peer-reviewed journals and meeting abstracts, as well as unpublished data in the public domain, and they draw the conclusion of fluoxetine, paroxetine, sertraline, citalopram, venlafaxine, and other antidepressant use. As to fluoxetine usage, the author wrote that there is no significant difference between fluoxetine and placebo in 40 subjects, where the fluoxetine group showed more improvement than the placebo group, but differences were not significant. while 2/3 of the sample showed marked or moderate clinical global improvement. We can say there are some antidepressants are useful, but some have risk and can cause more severe problem like induced depression and related suicide. This table presents the result of the FDA reanalysis of suicide-related events in use from antidepressants. The overall relative rate of suicide-related event in clinical trial of use by drug is 1.95. The author said it was a significant number. At last, let's look at depressive symptoms aroused by substance abuse. From the book of Manage Depressive Symptoms in Substance Abuse Clients During Early Recovery. The article said the depressive symptoms are common among clients in substance use treatment, and the term depressive symptoms refer to symptoms experienced by people who experience sadness, depressed mood, or blues. Although failing to meet DSM-5 diagnostic criteria for a mood disorder, and findings from 2001-2002 national survey indicate that substance abuse counselors will encounter significant numbers of individuals with substance abuse and depressive symptoms. The book wrote that a substance use disorder increases the risk of experiencing depression symptom or a depressed disorder. We see substance abuse, depression, and suicide is worth our attention. Thanks.